Alrighty, welcome back everybody to Crime and Plastic. Hope you all have had a great week and are getting ready for the holidays coming up. Do you guys have any holiday plans?
Me?
Yeah.
Holiday plans?
Yep.
No.
No.
Do you?
I don't know. We're gonna be closed for 2 weeks, so
Oh, we are?
Yeah. Oh.
well,
maybe
no
I'll-
surgeries for
Maybe
2
I'll,
weeks.
maybe I'll go on a trip. Maybe
Yeah.
I'll see my grandchildren.
Maybe.
I have to work it out.
Mm-hmm.
We'll see.
I was unaware that we were closed for 2 weeks.
Well, we're not. We don't have surgery for 2 weeks. I don't know if we will be closed.
Translation, I still work.
You're taking your vacation early.
Yeah, I'm going to... Well, by the time you hear this, probably I'll be back.
Where are you
From-
going?
I'm going to Santo Domingo.
Santo Domingo. What are you going to do there?
Chill. What do you do in DR?
Drink poisoned alcohol?
Oh, that's on a cruise. Or was that a resort?
No, that was in DR
Be
resort.
careful.
It was a resort, though. I'm not staying at a resort.
I'm sure you're going to do... Are you going with
I don't-
friends?
I'm going with my friend's family.
Oh, nice.
Yeah.
Oh, that'll be fun. I'm
And
sure
like a
that'll be
big Airbnb.
first class, yeah.
Yeah, it's
They're
super
rich,
nice.
rich friends, yeah?
They're rich in the DR.
Good.
No, they own like a bunch of property in the DR, actually. And that's why her
Sounds
family's...
rich to me.
To own a property in the DR is like $100,000.
Megan's also going away. She's going to Puerto Rico.
Oh.
Yes.
Mhm.
PR.
Where you-
PR and DR.
Where are you going in Puerto Rico? Okay.
Megan's not a planner. She says, let's show up and figure it out.
Are you
Love
flying
it.
to San Juan? Old San Juan is nice. I stayed there for like a week a couple years ago.
Ah, you're saying in a sketchy Airbnb?
She said,
Nice.
"Nah, you'll be okay." I feel like everyone in Puerto Rico is so nice. Plus, it's like a U.S. territory, so like it's all they have like dollars. You don't have to like convert your money or do anything like that. They can't really rip you off. You know, like when you don't understand the value of whatever currency they have.
Right. They're
They're like,
Like,
give me
right,
10,000 of
yeah.
those.
You know,
40,000 drachmas. You're like,
you know,
huh? Okay.
I went to Ecuador, to the Galapagos Islands a few years ago, and I was at the airport and I said I had to get a taxi, so I'm like, let me change my money so I could get Ecuadorian money.
Mhm.
And I go to the change place and I give them my dollars, and they just give me back less dollars. They use dollars in Ecuador. I was like, you're a bitch. Why do you? I was like,
Wow. They took like a percentage
yeah, I was
of your
like,
own dollars.
I was like, give it back. I didn't know you guys use dollars here. I mean, bad on me, but
Yes, bad on you.
That's
But I
crazy.
had
That's
no idea.
hilarious.
I had no idea they used dollars in Ecuador. She just gave me back dollars. I'm like,
But less.
you couldn't mention that when you saw my dollars.
She did the conversion like right there and then.
It's probably a whole scam.
Yes,
you're,
yes.
You're not the first.
So guys, when you go to Ecuador, they take dollars.
Yeah, don't change your money
Don't
into,
change your money.
into
they
less
take dollars.
dollars.
That's
Yes.
wild. as
What's the
fuck.
exchange rate? $97 for every $100?
Yes, I felt quite the idiot.
That's well. I gotta go look up if DR they're using
It's
dollars.
funny because you were going to the Galapagos Islands to see where Darwin discussed his evolutionary theory, and
Yes.
you just evolved
Yes, I've
smartness wise. They're helping you.
Maybe I shouldn't have been selected.
Natural selection.
I was an anomaly that passed through natural selection. Sorry, Darwin.
I don't think you took into account Google.
Yeah,
I couldn't have expected you to know that.
sorry. I'm not a planner either.
Mm.
Anyway,
Okay.
so I hope everyone has fun holiday plans, and
By the way, I got no news this week. Nothing.
that's 2 weeks in a row, no lose.
Nothing.
That's because it's only been 30 minutes
Yes,
since
guys.
we last recorded.
Well, even the last 3 weeks, I've been looking for news, and
Yeah.
plastic surgeons have been behaving. I think because of our podcast. I think
Yes.
that's what it is. They know
There's-
that if they screw up,
They'll be on the podcast.
exactly.
That's true. We are providing a service to this world by not wanting to be on the podcast. We're doing our own natural selection here. Okay, so today we have the story of Dr. Peter Norman
Norman.
from Arizona.
Okay.
So Dr. Peter Norman was he went to school in, I think it's called St. George, the one in Granada.
Yep.
And then he did an internal medicine residency in. Oh wait, I have it here actually.
I'm guessing New Jersey.
No, Providence, Rhode Island.
Okay.
Roger Williams Medical Center.
Mm-hmm.
He was emergency medicine, internal medicine.
Oh, okay. I think that's the Brown University Hospital. But okay.
Then he decided to do something called Lunchtime Lipo. He started promoting.
What years are we talking about here?
This is.
When did he go to medical school, etc.?
He went to medical school. He graduated medical school in 1994.
Okay.
And he did his residency 1994 to 1997.
Got it.
And these stories happened in like 2006.
Okay. So he's in practice for 10 years, starts doing lipo,
Yeah.
which is not uncommon.
Yep.
A lot of doctors take up lipo as like a side gig.
Yeah. Apparently he didn't get much training in it. He took this comes out later that he took like a 6-hour course in liposuction. So this first patient is Jeanne Schwark. She goes to get this lunchtime lipo, a quick, minimally invasive liposuction procedure.
And he's practicing in Arizona, you said?
Yeah, in Phoenix.
In Phoenix, okay.
She goes to his clinic in Phoenix. She's given some pills, locks her out, and then she wakes up and at 10 o'clock, 12 hours later, she's in immense pain. She feels like she's beaten up. She was bloody, which is not uncommon for lipo.
But
everybody.
lipo of where? Of the tummy?
Yeah.
Okay.
Yeah. So you do feel like you're beaten up, and you do have oozing. It is kind of scary. Liposuction.
It's terrible.
It's not.
Shut up.
It's not terrible. I'm just saying, like, it's not necessarily frightening, like alarming or worrying. These, like, if you have things like that.
If you had lipo and you have pain and you have drainage, that's normal. But
Yeah.
now immense pain, what does that mean? Like,
So she was someone who worked in the medical field. I'm not sure exactly what she did, but she had some medical knowledge. But she said she woke up and she felt like something very bad had happened to her, and she didn't know what it was.
okay.
And she had to get home as quickly as possible. She woke up in the clinic, I guess. And then she said she made it home, collapsed on her bed, which looked like a crime scene, which is also
After lipo, your bed looks like a
possible.
crime scene. That's why you put down special sheets and
Right.
special absorbing pads any
Yeah.
place you sleep after lipo for the first couple days. By the way, this was supposed to be lunchtime lipo. So
yes.
literally she's supposed to go back to work.
Yeah, I guess. It didn't work out for her.
I mean, maybe she works if she works in
Yeah,
a hospial, then it could
maybe.
be like
I was
lunchtime
literally
lipo.
about to say, like, people do surgery at 2 p.m. every day. What makes it lunchtime?
No, but the idea is that you
Yes.
could like duck out for lunch, get
Right.
lipo, and come back.
Yes.
That's the most ridiculous thing I've ever heard.
Yes, I think it was a marketing gimmick.
That's a good marketing gimmick.
Yeah.
If you could pull it off.
So she
Like,
said
you could only for the people that work in the ICU, then it's lunchtime lipo. They go right back to the ICU where they're unconscious.
Oh, okay, I get it.
So she said that she found 7 incision holes that were infected.
Oh, wait, that fast?
Her story, I mean, he does worse things. Her story is just like I think just someone complaining.
Okay.
Seven incisions? How many incisions?
I mean, it depends how much
Depends on the
lipo,
areas.
how much
And then he
lipo she
said-
got. But you can't get it. It's hard to get infected
She
like
said-
immediately when you get home.
She said with her background in healthcare, she knew the best course of action was to
Go to the ER.
no, she didn't. She just performed wound irrigation and allow them to heal on their own. That's why it doesn't sound like they were
Well,
that bad.
That's probably why they got infected.
Yeah, I don't know.
The best course of action after any surgery, if you feel like something went wrong, and is to go to the emergency room.
So she thought that her treatment was, she felt that she knew Dr. Norman's treatment qualified as beyond negligence, but she failed to report him to the Arizona Medical Board because she was embarrassed professionally and blamed herself for what happened.
Oh,
Okay.
Okay.
So she never said anything. And then 3 months later,
Mhm.
the authorities were called to Dr. Norman's office.
What
okay.
happened?
So first, on December 12th, 2006, the first responders arrived to the clinic, and 33-year-old patient Ralph Gonzalez had gone into cardiac arrest during a liposuction procedure. His stomach was severely distended, and they thought, so basically he was doing liposuction. The guy went into cardiac arrest. It was under local, so he
Mhm.
tried to intubate him, but he put it into his esophagus instead of his trachea.
Ooh, yeah, that's not good.
How do you know if you've done that?
Good question. So first of all,
Good question.
when you intubate, you hook up to a capnograph or capnometer, which detects CO2 output. So when you breathe in oxygen, you breathe out carbon dioxide. So there's a little thing that detects carbon dioxide. If it's in your lungs, then you'll see the waveform of the carbon dioxide go up and down. If it's in your esophagus, there's no carbon dioxide coming out.
Okay, so
That's
what happens?
one.
You just pull it out and put it back.
Yeah. That's one. Two, when you press the bag, you're supposed to see the chest rise and fall. Instead, you probably saw the stomach get bigger. So when he said the stomach was distended, that was a sign that they'd intubated the esophagus and they were pumping air into the
Is your
stomach instead of the
chest
lungs.
supposed to rise and fall dramatically, or just like as much as you would normally?
As much
breathing?
as you push the bag, because theoretically you're intubating, you're squeezing the bag.
I'm
the little
saying-
balloon of the air. So you squeeze the bag and it goes. Also, you can put your stethoscope on the chest and listen for the air going in and out.
Is it an easy thing to mistake, to do the esophagus instead of the trachea?
Of course, it's easy, but it should be. But
But it's easy to recognize also.
It's easy to recognize. Like you should immediately recognize it. You have about 2 to 3 minutes to intubate somebody, so it's not like, and that's a long time. You know what I mean? 3 minutes. If you just think about holding a stopwatch for 3 minutes, it feels like a long time. So you have
Yeah.
time to go in, check, see that it adjust, try again.
Why do you only have 2 or 3 minutes? Because they're not breathing.
Right.
Oh, that's crazy. I didn't know that.
Now you can put a mask over them and bag them indefinitely. So you can bag them with oxygen. Some of it goes in the esophagus and some of it goes into the lungs. That's not ideal, but it's something. And then you can try again to intubate.
Right. So, and then the paramedic who came in, his name was David Duarte. He came in and he saw people doing CPR, and he said nobody looked like they knew what they were doing. They were just panicky, kind of like trying to whatever.
Right.
And they put the paramedics took the patient Gonzalez into the ambulance, and Dr. Norman jumped in the back with them.
Mhm.
And
Now he was an ER doc,
yeah,
so all ER docs know how to intubate and do CPR. It's like what they do, just like their bread and butter.
no, this one.
Okay.
So he came in.
Oops.
So Duarte, he was 100% sure that the tube had been inserted incorrectly. He took it out from Gonzalez's stomach, and when he tried to intubate him again, Duarte tried to intubate Gonzalez again. Dr. Norman grabbed the tube and forced it down his throat in a very violent manner, which resulted in blood spurting out of his mouth.
Oh my
And then
God.
The paramedic said, "I've never experienced anything like this," and he was like literally stopping him from doing what he knew how to do.
Right.
You know, and then then he was trying to save Gonzalez's life. He basically elbowed Dr. Norman in the neck to get him out of the way, and then when he got to the hospital, he was dead. The patient was dead.
So
So do you think that tube into the mouth was like really the nail in the coffin, or
yeah, probably.
you think so,
Probably.
or he was already kind of like a goner?
Well, we don't know. What the autopsy show? Had he had a heart attack? What was the reason for the CPR?
They
Did
said
he
cardiac
overdose? Did he overdose on the lidocaine?
Yeah, I think it was that. It was the cardiac arrest, and then he tried to intubate him, and he did it wrong.
Right.
Then, so the
Not good.
paramedic, he was shocked by this guy's.
Let me just go back for a second.
Yeah.
If you don't know how to intubate somebody, you're better off just bagging them with the little mask and the balloon thing, than trying and failing and
Yeah. So then Duarte called the paramedic. He called the Arizona Medical Board to file an official complaint. They didn't find any violation of the Medical Practice Act. They opened an investigation and they didn't find a violation on him.
Right.
So they didn't find a serious violation, and whatever. 4 months later,
Now, for a second, in their defense, I mean, if he tried his best but he fucked up, I mean, that's not like, people make mistakes,
right,
right?
Yeah.
They panic and,
Yeah.
It's not like he didn't call 911
right,
or he didn't recognize there was a problem. He
Right.
just
He
did
just-
not act quick enough.
But
or-
why do you call 911 for assistance, right?
Obviously.
So why the fuck get in the ambulance and try to hinder the assistance?
I
For
hear
that,
you.
should have not called
That
911.
was a mistake. But in his mind, he could think, I'm an ER doc. I know what I'm doing. Who's this young paramedic? How do I know if he's better than me? Like, I could see how in his mind he thought he was doing the right thing. I'm going to give him the benefit of the doubt. Okay, so the medical board found that he was okay. No violation of the Medical Act.
right.
Okay, then what happened?
Okay. So this one, 2007, 4 months later, again, emergency responders were dispatched to his clinic.
4 months later.
Yeah, 41-year-old Alicia Santizo, she coded during a procedure.
Oof.
Then, again, he put in the he put in the tube wrong on her,
Ay, ay.
but she ultimately died of a fat embolism. She was getting a BBL and it went into her. He injected it
But-
into a vein, but in the process of trying to resuscitate her and everything,
He intubated her esophagus.
he intubated her wrong again.
I mean, it's not so easy to intubate, but it's also not so hard.
but like you said, he was an emergency room
You
trained
should be
doctor.
able to do it. Yeah.
So,
Like I haven't intubated in years, but I know I could do it.
right. So when the Heinrichs was the paramedic this time, and then when he went to the when they brought her to the hospital, she ultimately died of the fat embolism. He ran into the other paramedic guy, the Duarte. So he was like, "Fuck no! Like this can't happen. This is happening too much." Like
Right.
so they filed. So they contacted the board and they put like a temporary restriction until they had on his practice until he had a chance to investigate what he was doing.
Right.
Then
Is that his picture?
I'm sorry,
Is it?
like you have 2 patients die in a 4-month span. Like you're weird.
that's his
Yeah.
picture.
Okay. Okay.
Okay. So then they had the board of medicine, they had plastic surgeon Edward Eads to consult on the case to do the investigation, and he said they found he discovered a laundry list of deviations from the standard of care and that his clinic was a surgical nightmare. He said that before the first person he was given the liposuction who arrested, he was given 10 times the lethal dose of lidocaine, causing
That's
his oxygen levels to drop and his heart to stop.
Yeah.
And then when the breathing tube was inserted improperly, it hastened his death. Then they found that during Santizo's BBL that she suffered cardiac arrest due to fat embolism and causing her heart to stop.
Terrible.
Then
But it's that fast.
Yeah.
A fat embolism.
Oh yeah. Fat embolism is instant. It's instant.
yeah, people die on the table from
How does that
God
happen?
forbid. So if you
Injecting the fat into the muscle.
yeah, well, below the muscle into a vein. If the fat
Oh.
goes into a vein, the veins are like below the muscle there, and if it goes into one of these major veins, it travels from your vena cava to your heart.
Okay,
And
and,
then it
can you
goes
stop
from-
it? Or is it like impossible, basically?
Pretty much impossible. Unless if you have the only way to survive like a serious embolism like that is if you have an ECMO machine available, like you go into extra because you can't oxygenate your blood anymore because the fat is blocking.
There's no way to dilute the fat like quickly, like they do with blood clots.
There might be, but I'd never heard anybody try it. They do have fat
Like-
dissolving
Like
stuff.
some
that
bile. Just
yeah, maybe you might. I don't know. It might dissolve your other vital organs
Oh.
in attempting to do that.
Oh.
So I don't know, but yeah, it's tragic. I mean,
It is tragic.
So if you have a fat embolism, you just hope it's small, and like not a major one. If it's a big one, though, it can go to your heart, lungs, brain,
Right.
et cetera, et cetera. But that's why we inject
Above the muscle.
above the muscle. That's why we inject with blunt tip cannulas that are big, and that's why we use an ultrasound now in Florida to see where the tip of the cannula is, et cetera, but obviously not in Arizona.
But you could still get. That's crazy.
No, but the technique that we use is you can't. I mean,
Because the vein is
the vein is
below the muscle.
Yeah, it's not in the
It's
area.
not in the
So
air.
how do they get so deep?
I don't know how they do it. Listen. Thank God it's never happened to me. I don't know how they do it. I've never been in a case where.
But
it's
wasn't that
happened.
how it was trained? People were trained was to inject into the muscle and
I
below the
believe they were
muscle?
trained
because
to
they thought
do
like if they
that.
did it under the muscle, it would stay. It would like pump up the muscle more, and it would stay. Like the fat would stay longer.
because there's more blood supply there.
Yeah.
So the idea, but
it's too.
How many people had to die for them to realize that that wasn't the way?
they still dying. They still dying from that BBLs.
terrible.
Unfortunately, it's
Terrible.
one of those things.
But by
It's a-
accident,
it's a-
not because they think it's common procedure.
No,
now.
because it's very technique dependent. It's like driving a car. Like if you know how to drive and you are a defensive driver, it's safe, right? But if you're drunk or or you don't know what you're doing, or you're not paying attention, you know,
Yeah, it's very sad.
that's what it is. Yeah.
Okay, so then while the board was investigating Dr. Lorman, and he's not supposed to be practicing,
What did he do?
first responders are called to his office again.
Oh,
Oh my goodness.
53-year-old Leslie Ann Ray was in distress. Her stomach was distended and she wasn't breathing.
oh.
So
no.
apparently, while he was on probation or investigation, he hired a homeopathic physician named Dr. Gary Page to do.
A homeopathic.
Yeah, I don't know what that is.
Homeopathic is like I give you a tiny eye of newt or something, like a
I
bit
don't know,
of something.
this guy was an actual doctor from California, but I think he had issues with the California board, and he went to Arizona, and he was part of the homeopathic medicine. I don't know.
But homeopathic medicine is not like it's not like MD
Yeah, I don't know.
or DO.
I think
Like you could be a homeopathic doctor. Like there's no
No.
like I don't think there's any like actual
I have no idea.
certification or school. You know what? Hold on. Let me Google that.
Yeah, I'm not sure.
What does it take to be a homeopathic doctor? What qualifications?
Vibes.
Qualifications does it take to be a homeopathic doctor? And what state was it?
Arizona.
This is Arizona.
Arizona. Let's see. Arizona Board of Homeopathic and Integrated Medicine Examiners. I don't know what this means.
I don't know. So
You do not need a license to practice naturopathy and homeopathy in California. However, you must disclose your advertisements that you are providing unlicensed healing art services.
Healing art
He
is
was-
crazy.
I think he was an actual doctor in California, and in Arizona, he was a homeopathic doctor, and he hired him to do the liposuction because he couldn't, and this lady died.
It says here, in some states, non-licensed professionals, Arizona, Connecticut, and Nevada are the only states with homeopathic licensing boards for doctors of medicine. And so maybe he did it. Maybe he was an MD. Okay.
Yeah, I mean, he was from California. I told you, he was a doctor in California.
All right.
So,
But you know homeopathy is a bunch of crock, right?
yes.
Okay.
Well,
But why wouldn't he have just hired someone who's already doing lipo?
Because he probably wanted someone cheap. Because
Maybe they wouldn't work with him because he had just had 2 deaths.
So she died too.
Oh,
This
no.
Leslie Ray.
Oh my goodness. I'm like triggered.
Like you'd think he would have changed up the special sauce or
And
the
he
formula,
said that
the recipe.
he claims that he didn't intubate her, but everyone thinks he intubated her because the same third time, that this wrong intubation was going into the esophagus instead of the trachea. And then, following Ray's death, he charged her credit card for the full amount of the procedure.
That's actually fucking
Shocking.
nuts.
Wait, are you sure the timing was real like that? It was after the death?
That's what they saying.
Wow, that is chutzpah.
Yeah. So then after this third death, they treat this
It would
as-
be worse if he charged her for the intubation.
Yeah. After this third death, they treated it as his office as a crime scene, and they found for Ray, they found a bloody endotracheal tube in the trash.
Not good.
My question
What year was this,
is-
you said?
2007.
Mm.
Your question is?
Okay. Obviously this would not be my stance, but just like from a legal basis, aren't the doctors entitled to the money even if the patient dies?
You're saying, so like a lawyer would be entitled to the money even if the patient gets the chair, you're saying, because they did their best, but it just didn't work.
No, but
they got
because death
convicted.
is a risk of surgery.
It is.
No, I'm not saying that.
No,
I'm
but
not
it's
saying
the
what he did.
after. It's the after charge. It's in other words, I agree that you charge the money before the surgery, but then
Yeah.
after the surgery's done, and not only is it a disaster, the patient is dead. Yeah, it's chutzpah to charge for that.
No. I agree.
I'm not saying no one's saying it's illegal. It's just
No,
saying
no,
that
It
it was
just
my
shows a
question.
state
It was
of
my-
mind.
It was my question. It wasn't.
yeah.
It wasn't. I had no doubt if it was
Wrong.
illegal. I meant.
No,
I
it
mean, I
might
had
be
no doubt if
legal.
it was wrong. I had
Yeah.
a doubt if it was illegal.
I don't know. I don't think it's illegal, but I think
I
it's
mean,
just
probably is legal.
yeah.
I mean, it was a contract service was rendered.
crazy.
just rendered badly.
That's fucking nuts.
It's a
So
nightmare.
then,
So they charge it as a crime scene.
they charged him as a crime. His license was revoked by the Arizona Medical Board, referred to the state attorney for criminal stuff.
Hallelujah.
He was indicted on 2 second-degree murder charges and 1 manslaughter for the one that had the fat embolism.
Right.
After posting bail,
Uh-huh.
he fled.
Where?
It doesn't say where, but he appears back in the U.S. and do that. They put out a warrant for his arrest if he
Mhm.
ever came back to the U.S. He was gone for about a year, and then he came back to the U.S. in an airport in Kentucky, and he was
What made him
arrested.
think that he was just gonna get in through Kentucky?
I don't know. I don't know why he didn't stay gone, but he
Yeah.
came back.
Good.
And in 2011, he was brought to trial, and he was convicted and sentenced to 25 years in prison.
Thank goodness.
How could I never heard of this story?
Then,
What?
on appeal, it got overturned.
What?
Because they said something like that because they didn't sever the charges, like they tried him on all 3 charges in all 3 cases at once instead of like separate facts for each one or separate like whatever, that it was error. The appellate court said that was wrong and it was harmful error. I guess because they use like state of mind from different procedure, I don't
Right.
know.
They show that he didn't fit right the first time,
Right,
second time,
right.
third time.
So it's like
Yeah.
they should have done it separately. So it got remanded back to the lower courts. He was trying to get it convicted again.
Oh.
So he was given the same 25 years again.
So he's
and-
still in prison, I would imagine.
He was tried and convicted again.
Yeah,
Wow.
The amount of fucking taxpayer money that was just wasted.
yeah. He was
Yeah,
found.
but think of the lives that were saved by not having.
I'm saying they could have just upheld the first conviction.
Oh well, that's the law.
Yeah.
The law is the law.
So there you have it. I know this is also I was surprised I never heard this story.
Heard that story. This is way before Dr. Death.
Yeah, they call him Dr. Death.
Yeah, but the
I know,
other
yeah.
Dr. Death, the
Yeah.
neurosurgeon Dr. Death.
Yeah,
This seems like almost even more egregious.
yeah. They called him like Doctor of Death.
But I don't
that
get
was
it.
his-
Like,
What was his first name?
Peter
Peter Norman.
Norman.
these people aren't sad. Like, they have no hearts. Like, how do they like lose a patient and then 4 months later they're just gonna keep doing this?
I don't
Like,
know.
aren't they,
I
not
always
even a
tell my
heart.
wife I'd be so devastated.
right? You should be
I
devastated
don't
or
think I
like
could function.
nervous or like scared of what else will
Yeah, it's terrifying.
that should like
It's like a pilot that crashes a plane. You go down with the plane. I'm
Yeah.
sorry.
And
I agree.
this is
Some
very
pilots
very
survive.
sad. He did
Not
it
like-
3 times. 3 times very quickly. Like
Yes.
one after the other.
You'd think it would have changed up the lidocaine formula after the first death.
Yeah.
But apparently, maybe not.
Not even that. Like, stop trying to intubate. Question mark.
Yeah.
Well,
Yeah, that's
Yeah.
what he was trained as an emergency doctor.
I mean,
That's pretty-
emergency medicine doctors intubate all the time
Yeah.
in an ER. It's like,
But I feel like emergency doctors don't. It doesn't match up with like cosmetic surgery. Like emergency is like all sloppy, and you just gotta get it fixed.
yeah, but even
and
but
plastic
you
surgeons are
can't
supposed
not
to be like-
intubate correctly in an emergency room
Right.
because
You don't. Yeah. You gotta.
Hello.
people would pick up on that pretty quickly.
What's a good? Yeah, that's what I'm like. I don't know how some of these doctors get through all the training and stuff and still be bad, like Dr. Death or like this guy who didn't know what.
So-
Okay, I know he switched over to cosmetics, so he didn't really get official training in cosmetic, but the emergency part that he did get training on, he also sucked at. So it's like, how do you not get like weeded out with all the years of training?
I don't know. I mean,
Like, is it?
I mean, it's rare. Thankfully, it's not like
Yeah,
every
no,
day.
I hear that.
There's like how many doctors? 300,000 doctors. And
How
we have,
rare
like,
is it when we have this podcast?
once a week? But of 300,000 doctors,
So, but what is the weeding process? If you suck, they just fire you,
you would hope, but sometimes
but they just try to keep.
they try to, because you've gone through medical school, you passed your exams, you obviously have a brain in your head. They think everybody is teachable, and if you get along with people, people will help you through residency. They'll cover for you here and there. They would not like let any of their family members be taken care of by you, but they'll like kind of help you, hoping you're going to learn. The problem is when you get into private practice, like the Dr. Death neurosurgeon or this guy, once you get on your own, there's no more training wheels. And that's when,
But Dr. Death was in private practice? No, he worked at a hospital.
no, he's in private practice. I mean,
He did the surgeries in the hospital,
you
but
can be private practice means like not in an
I know.
academic. You're not like part of an educational system where there's
I just didn't know
other
that
people you're teaching and stuff.
neurosurgery could be private. I thought you
Oh,
had to be like a
neurosurgery's-
staff member of a hospital.
No.
you do.
Private practices, almost all private practices are members of a hospital too. Private, you're confusing like the fact that in plastic surgery, like I rarely have to go to the hospital. That doesn't make me a private practice. Private practice just means you're not in an academic setting. So private practice means you're not in a university, you're not a professor, you're not teaching students, you're
just seeing patients on your own.
you're
Like,
seeing patients on your own.
it could be on your own in a hospital, but it's still like
Correct.
it's your patients.
Like the majority of doctors are private practice doctors in hospitals.
Yeah, but I felt
It
like
just means that you are collecting the bills as opposed to taking a check from.
But I just thought that because
university.
like I felt like in hospitals there's like departments, so you're just like a staff member amongst like you're not just the only neurosurgeon, like you're.
The same thing, and I'm not.
But like
there's
you get assigned
So
cases. People
Derek Shepard, was he a hospital guy or he was
I
a
didn't-
private practice? He
didn't
was like
watch
the
the
head of he was the
show.
head of neurology of blah 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 hospital.
Is-
Seattle Grace.
Was he part of a university? That's the difference.
Well, I mean, he obviously taught.
Yeah.
Yeah, but you can
But he
like
wasn't being
Mount
taught.
Sinai is a private hospital, but it has a teaching program. So the surgeons there are still considered in private practice, even though they're a part of a residency.
But how do the
program.
cases come to you? Do people seek you out, or you just get assigned them like by random?
No, so it depends. Like certain specialties, you can't be sought out. Like a pathologist can't like seek out patients. A radiologist can't seek out patients. Those are an anesthesiologist in a hospital can't seek out patients. They're by definition attached to a hospital. They're still in private practice in that they bill the patients themselves, as opposed to the hospital or an academic center billing and then paying them a salary.
So if someone
That's what I thought it was. I thought that all the people who worked at a hospital were getting paid a salary by the hospital, and the patients all pay the hospital.
So some departments and some hospitals are like that. Like intensivists, sometimes are hospitalists, sometimes are like that. They're salaried by the hospital. But still that's considered private. Still that can be considered private practice if it's not a unit.
So if a patient goes to a hospital and they say, "Oh, we need a neurology consult," and like the neurologist in the hospital comes to see them,
It could be a private practice neurologist. Could be.
he's just like working. He gets paid
He's
from the
on call.
hospital too.
No,
Yeah, they pay him for his call.
sometimes, but not those specialties.
It's a very
neurologists
ambiguous.
neurologists usually don't get paid for being on call. Like certain specialties, certain surgical specialties of which they're in high demand, and the hospital can't function without, like a trauma surgeon or a plastic surgeon.
So why do they do it? Just
they'll-
for the referrals?
Yeah, they're on call for the referrals. That's how are they going to get patients? It's hard for them to advertise
Right.
neurology.
Well, there's a
say-
great neurologist on TikTok.
Yeah, that lady.
That lady.
Yeah, the
The,
spine doc.
the neurosurgeon. That's,
Yeah.
that's neurosurgery.
Yeah, you see like spine doctors. I feel like they're like in private practice. Like you can
So
go.
I think you're confusing like private. So when you say private practice, it means not academic medicine. It doesn't mean that
Private
they're-
office.
It doesn't mean
I'm
a
thinking of private
off-
office.
Yeah,
That is
Your
built
office
separately.
could your office could still be in the hospital, but you're
still in
still
private practice. Like I had an office at Memorial West Hospital in the hospital. I was still in private practice.
No, yeah, I understand that.
Yeah.
But it's a little bit different because sometimes there's patients that are in a hospital and they see a doctor. You think the doctor works for the hospital.
Yeah.
Right.
Like
but
like when you're like
only in-
someone has a heart attack and the doctor that's there comes to see them.
so that
like it's like
the ER doctors generally are paid by the hospital
no, but now ER doctors also have their own like groups that they work that they
and they
it's
contract.
to different hospitals and
Yeah.
stuff.
So I mean, there's all kinds
It's
of
very
ways.
it's very
So
yes.
weird.
But in general, there's just two divisions. There's academic medicine and
And-
private practice. And
right.
academic medicine in general is you're attached to a university, you have a university title, you teach more.
Right.
You know what they say?
Yes.
Those who can't do teach.
Yes.
So I'm not going to cast aspersions on all of them, but it's hard to find an academic plastic surgeon that does hundreds of BBLs a year or
Right.
hundreds of tummy tucks a year. They're usually teaching, giving lectures,
Yeah.
dealing with the residents, doing a lot of emergency work and that sort of thing.
Right.
So it's hard to find a cosmetic academic plastic surgeon. There are a few,
Right.
but they're rare.
Well, Peter Norman was not academic
No, he was not.
and was not good in private practice, and
And a lunchtime lipo.
it's not a good idea.
No,
I think that it like the sense of it, like the feeling, like the
you like the vibe.
I didn't just like I think it could work, just not for like a lot of lipo.
Well, let me ask you a question.
Like I thought that
Sen-
my arm lipo would
was
be
le-
like lunchtime lipo.
Okay, but not
Could
having
it?
gone through it, could that have been a lunchtime lipo? Could you have gone back to work after it?
well, I was TikToking the next day. I feel like you can get like lunchtime boob job,
What?
right?
No, you can't
I
get
mean-
anything under anesthesia. You can't really do for
Yeah, I
lunchtime.
guess the anesthesia part's the one that knocks you out, but
But even
think
if,
you get a
even if it's
lunchtime
not,
boob
you're
job.
not going to feel great after surgery. Even the most pain-free, and sometimes I do breast augmentations, and the patients feel fantastic the next day.
no, I've seen them.
But they're not.
I don't know about.
Yes, but they're not going to go back to work. So like the lunchtime concept, I think is
Right.
a
It's
complete
more like
lie.
a facial or a massage is for lunchtime.
Yeah,
I think you could.
but not surgery.
I think it could happen.
We can
Boob
make it
job.
happen.
Boob job.
We can
Maybe like an
make
areola reduction.
it
It's simple.
A boob job. Like I got my lunchtime tooth pulled. Do you remember?
Yes.
Yeah, sure.
Yeah.
Maybe it's more of a thing for dentists.
Maybe.
Lunchtime.
Teeth whitening.
Lunchtime. What's that thing called? Wisdom tooth removal.
Yeah. Most people
Not
it can't be
even.
lunchtime.
No,
You
I
were
got my
that was a
wisdom
rare
teeth.
case that you
I
got
did that.
That's what she did.
I had my wisdom teeth. I was out for days.
Yeah, wisdom teeth.
My face all swollen.
I literally walked downstairs, got it done, and came back an hour later.
Yeah.
You're a G.
Yep, you are.
Not on the arm lipo though. I was a baby. I wish I never did.
Well, it
that.
wasn't regular size.
No, I also think it was the anesthesia that fucked me up.
Yeah,
It
she
could
didn't like
be.
she didn't like being out of it, like not knowing what was going
Who did her
on.
anesthesia? Barry, you're saying?
Barry.
No, it was
good.
yeah, it was Barry. It felt, you know exactly what it felt like now looking back. When I was in high school, oh no, my mom's gonna hear this.
She's not going to hear this.
She listens to every episode.
Pandora, turn it off for the next 2 minutes. Go.
When I was in high school, everyone was like smoking these dab pens, right? Like weed, whatever.
What's
And
a dap pen?
It's like a vape but with weed.
Oh.
Okay. It was like the biggest thing. Like everyone was fucking high in my sophomore year. But I didn't want to smoke because I was scared. But I was like, my friend offered me a brownie. Like a whatever.
Yeah.
So
An edible.
an edible. So but it was made in someone's house, whatever. So they're like, eat half. So I eat half, and nothing happens. I go through 2 periods and nothing happens. I'm like, oh shit, I guess I ate the wrong half.
You're immune.
Like it's made in someone's
Right.
house. You don't know how it's
You ate the
distributed.
wrong
Right.
half. That's
So-
funny.
I'm like, okay, let me eat the other half. So I eat the other half, and I'm good for like another hour. School ends. My friends and I go to this pizza place, and all of a sudden, it was like I took a sip of water and I entered like a different dimension. And I was like coming in, like I just felt like coming in and out. Like there was like moments of clarity, and then I would be like sucked back in. And that's exactly how it felt when I was coming out of the anesthesia. It was like I would come out and I'd be like, and like my words weren't making sense, but like I could understand everything around me, and then I would get sucked back in and then come back to, and
She didn't like it.
yeah, I
But
didn't.
Safe to
Is-
say.
is-
She did not like
don't
it.
you think it's cool the way anesthesia works? The way like you get the medicine and then there's like a gap in your timeline.
It
Like
really,
there's no dreaming. It's just like you're asleep
Yeah.
and then you're in the recovery. There's no like
Yeah.
in between state.
it
Yeah.
is really, it is. When I woke up, actually at first, I didn't think the procedure had gone through.
Right.
Yeah, most
because
people,
most
are
people
like,
don't.
what?
They're like,
finished?
it's over.
I thought
When
something.
are you gonna start?
Yeah, I thought something wrong happened because I felt like I had like it was instant. I was like, oh man, it didn't happen, but then I felt the pain, and I was like, did you do it? Yes, we did it.
We did it.
Like, was it good?
Yeah.
We did great. We took out 1,000 cc's. Is that a lot?
Yes, it is a lot.
Skinny arms.
Yes.
Skinny model arms.
All right. Well,
Well,
thanks, guys, for tuning in. That's our story for today. Dr. Peter Norman in Arizona. And we'll be back next week with another story for you.
thank you for another great episode.
Yeah.
And this week's episode was brought to you by Crocs. The best Crocs in the world are Crocs. And Instacart. It's not instant, but it is like magic.
And HBO and that one weird show where you get to look at a bunch of flaccid penises.
naked
Attraction.
dicks. No, naked attraction.
Thanks, guys. Bye.
Bye.